worldwide COVID-19 pandemic highlighted that health crises have no borders. So it's important that information on the medical background of a patient should be available to all citizens and healthcare professionals wherever they are in Europe. The growing need for cross-border healthcare in recent years has consequently been a trigger in the adoption of digital health tools. Currently, 2 cross-border e-health services are already operational in several European countries. The e-prescription and dispensation allows European citizens to get their medicines from a pharmacy in another member state. The patient summary provides medical information to ensure healthcare for patients coming from another EU country. Leila is Portuguese. During her short stay in Luxembourg, she fell ill and needed to see a doctor. Luxembourg is among the member states already running the patient summary service. Since Leila has given her consent for cross-border health data exchange, the doctor can access her medical records and overcome language and medical standards barriers.
It may be possible that there will be problems of understanding and communication, particularly in terms of language. This is why it's important for patient and doctor to be able to safely have data translated into the language of the country in which the doctor practices.
Luxembourg has been running the patient summary service for 2 years now. Once the patient agrees to share health data, doctors can access useful medical information.
The data accessible at the level of this cross-border exchange are patient's doctor, diseases and surgical interventions that the patient has had in the past, medical devices, allergies, and particularly drug allergies, treatments and vaccines.
At European level, the full potential of digital health will be reached in the next few years with the implementation of the European Health Data Space. To facilitate cross-border exchange and sharing of health data, Luxembourg has implemented the technical requirements to enhance interoperability between IT systems.
For the implementation of the patient summary, we have to master some challenges. On one hand, to implement the technical interoperability, which means to let the systems communicate, to implement semantical interoperability, and also to provide data in a coded and structured form to allow this translation and transcoding for the health professional.
Interoperability between health systems across borders have also positive effects on healthcare costs, as it reduces duplications of clinical tests. Another important benefit is the quality of diagnosis, as explained by an expert in digital health that we contacted in Brussels.
This will actually promote the continuity of care. It also promotes the safety, because sadly what we see right now is that because of a lack of information, doctors and nurses sometimes make medical errors, and this can be damaging or even fatal to patients.
Protection of patients' health information is key for data sharing, so the infrastructure must meet high security criteria.
All the different IT systems in the different countries are connected through national contact points for e-health, and the exchange of data across the EU takes place through a separate network that is not connected to the internet to ensure the safety of the transport of the health data.
Patient summaries and e-prescription services are already fully available in 10 European countries. Over the next few years, they will be progressively implemented across Europe in supporting quality healthcare for citizens and without borders.